I don't know how long this chapter is going to be, but I can still think of it as sort of her last chapter.
This is a reflection of my day today. I don't even know if I want to talk about it. I felt really selfish. Today was the first day that I saw her, how outsiders see her. Everything has changed. She just started throwing up. Like, on the way home, she just started throwing up. She was so helpless. Hey, y'all. Welcome to another episode of Caring for Carlos, A Daughter's Journey. Hey, Mama. You ready to go? Yeah? Cool. Yeah. Hello.
Knock, knock.
Hi.
Hello.
Hi.
Is this Carlos?
Yes.
Am I pronouncing that name correctly? Okay, fantastic.
Do you mind if my camera is on? You're not in it, but...
Oh, no, I don't mind. That's great. Okay.
This is Justine. That's my youngest sister.
Hi, Justine. Nice to meet you.
Hi.
And this is Marlon.
Hi, Marlon.
How you doing?
And are you
Son-in-law.
Sherilyn?
I'm Sherilyn.
Okay.
Yeah.
So let me just make sure I know who everybody. So her son-in-law, Marlon. Okay. And then tell me your name one more time. Justine?
Justine.
Yeah, okay. And so I want to welcome you all to the clinic. So I want to talk with everyone, but I just want to start by trying to ask some questions to Carlos. So, hi Carlos. I'm Dr. Skylar Scott. Tell me, what brings you in here today? Why are you here? What's your name? Are you in any pain? Are you in pain? Okay. So is she nonverbal? Yeah. Okay. Just wanted. I just always like to check.
You might get a yes every blue moon, but that's about it.
That's why I tried. Yeah, to get one.
You'll get a head nod sometimes, but.
Okay. Or a head shake. So who wants to be a little bit of a spokesperson? Is that you? Okay.
It's me.
So, since we're meeting for the first time, why don't you just start from the beginning and walk me through what has happened from a cognitive standpoint, a memory thinking standpoint.
From the very beginning?
Yeah.
2012, she was at work. She passed out. They said that she had a stroke. She was seen at Kaiser. No evidence of a stroke on her scans. She did sort of lose memory slightly at that point, but it fully rehabbed and went back to work. And then
did she return back to her cognitive baseline?
And then 2014, Justine?
Yep, about that time.
2014, she started to just forget where she was going, sort of very apathetic. And then that just progressed over the years, and I want to say 2017, 18, she started to wander and get lost. Does that sound about right? Not able to catch the buses and go to familiar places. She was
a change for her.
Yeah, she was diagnosed with depression, schizophrenia, anxiety, all these mental health things. Was given a cocktail of medications. Did see neurology. She did have some, I think it was a CT scan way back. Neurologist said that it was just mental health. All her symptoms were somatic, and that it could not possibly be dementia. She was too young. And so heard about palliative care and just advocating and things like that. And so we saw the neurologist and asked her to refer us here. And then we got a spinal tap with Dr. Shah. And then they confirmed that 2021, I believe, that it was Alzheimer's. But by that time, she was already in advanced stages, so we couldn't, there's nothing much we can do. Shortly after that, we connected with palliative care with Dr. Hannah. She was about 98 pounds at the time. not thriving, not able to hold weight, and then we went on hospice for a year. She moved to a skilled nursing facility for that time, and then she recovered, graduated from hospice, gained her weight back, and since then, past 3 years, she's been in a memory care facility in Walnut Creek. That's pretty much the high level version of like Cliff Notes.
Okay.
Yeah.
Is there any from a functional standpoint, in terms of her level of independence, are there things that she's still able to do on her own?
Not anymore.
Can she feed herself? Or no, she needs to be fed. She can't use utensils. Okay. And they do everything for her, bathe her, clothe her, all of
feed her,
things.
yeah.
And that's from a cognitive standpoint, not a motor standpoint. It's that she doesn't remember how to do those things.
Same with her motor skills as well, yeah.
But, you know, the things she can't do in terms of bathing, dressing, that's partly because she doesn't remember cognitively. Okay, so, and how's her mobility? Does she walk?
No.
Okay, so she's either chair or wheelchair bound?
Yeah, chair, bed, or she can stand assisted, and then once she's going and her, her motor gets going, she can walk assisted, but not long. She gets weak and she sorts
a few steps at most.
Yeah, she sorts of goes back down.
So she can transfer. Any falls?
She fell out of this chair about a month ago. We've noticed that she's increasingly getting more sleepy. And so like today when we got there, she was bent all the way over in her chair. But that's what had happened when she fell. She bent over in the chair and fell forward, and she hit her head. So now when she is in this chair, she has like the seatbelt on, but they got her another chair that's for the memory care that has a higher back, or they put her like in looks like this bed on wheels, and she's sitting or kind of laying in that bed so that she can still be out and about in the, amongst all her friends.
Yeah, so the high back chair kind of allows her to sit farther back.
It has like head support.
Yeah. Okay. Was that an isolated fall, or she's had recurrent falls?
That was just that one.
Okay. How about her movements in general? Is she stiff and slow, or is she pretty fluid with her movement?
She's like this. Constantly has her hands up. Both left hand is really clenched tight. Right hand is starting to do the same. But she, for the last few years, she's kind of been in this position. She's had occupational therapy off and on over the last year.
Okay. Where they come to the memory care unit? Did she have physical therapy as well? Okay. And that's both been within the last year?
And then speech therapy about 2 weeks ago.
Okay.
She's been having issues with her swallowing, or they were concerned about the swallowing.
Has she been choking on her food?
She hasn't been choking. She's been pocketing and drooling. Dr. Hannah put it in his note yesterday, but they said it's because she's tired and the eating makes her tired. She also has like dental teeth decay, and so she's getting tired and sleepy while she's eating, and so she was pocketing the food because she was sleepy. So she's on a puree diet now, just for safety.
I see.
And then when I'm able to go, I'll bring her other stuff that I can watch, that it's not something she has to chew, but like we had a poke bowl today. She liked that, so I'll try to bring her.
Has she had a formal swallowing evaluation?
With the
barium?
No, just with the home health folks.
Like a bedside swallowing evaluation? And that's when they decided to do the puree food?
Yeah.
The bedside swallowing?
Yeah.
That was this year?
That was last week.
Okay.
2 weeks? Last week?
A week ago.
Yeah. And I think there might be a picture of what he wrote out, the speech therapist, in her chart. I sent it in a message yesterday.
Oh, that's why she saw the speech and swallowing person was for the swallowing. Okay. And her arms are stiff, or her legs pretty stiff as well?
I wouldn't say they're stiff. They're just swollen from sitting in this position.
Got it. Okay.
Yeah. You agree?
Yeah, because when I come and get like leg rubs and stuff, there's not really any stiffness. We're okay with like bending her legs and everything.
Okay, good. Does she seem like she's in pain? Does she ever moan or
she
like when
like
she moves?
yeah, she jerks a lot.
Jerks like jerking like this?
Yeah, like pain.
Yeah, she went
From
to
different pain or just in general?
both.
Yeah, both.
Not like if you like right now, like not like a constant pain where I think she's aching. No,
Yeah.
but she has these like jumpy.
Is the pain when she moves or just any time?
I think the pain is mostly when she moves, but I noticed that she gets really jerky when she moves herself sometimes. So maybe she's like.
The jerking happens in the setting of movement, so when she moves, she jerks. Any tremors that you notice?
You notice any shaking?
No, not really, no.
Has she been mentioning any hallucinations? Or, I know she's not verbal. Does this ever seem like she's seeing things or hearing things?
She goes. What is it called? Catatonic.
Yeah,
She goes into space, and her eyes drift.
In those moments, can you kind of get her attention?
Sometimes. Yeah, but sometimes no. A lot of times no. Her primary, when I brought that up to her, said that to bring it up, that maybe she might be having absence seizures.
Yeah, I made a note.
Oh, okay.
So we'll talk about it too. We're on the same page. Has she agitated at all?
No.
Okay.
She's pretty chill.
Okay. Good.
See this?
Cool.
She does that. She does this shaking.
Yeah.
I don't think
It's almost like a shivering movement.
Yeah, but I don't think it has anything to do with cold. No, she
Okay.
does that. She does that all the time.
Okay.
Or like she'll grab her shirt and do that same motion.
Yeah. Does she act out her dreams? Does she kick or punch in her sleep? Do you know?
No.
Okay.
But yeah, see, this is she does this all day long.
Okay. And just to switch gears a little bit, I just want to ask about her general health. So I have here anemia, anxiety, arthritis, depression, high blood pressure, high cholesterol. Anything else on that list? Anything I missed? No. And then in terms of her current med list, just want to make sure I have this right. So she's taking Tylenol as needed. Does she get it
when she needs it? They're pretty good about that whole list. They're pretty good about managing her constipation, her the Tylenol.
Good, because she won't be able to say she's uncomfortable.
Yeah.
Okay, so she's on the Norvasc and then the Dulcolax, right? And I see the Ativan as needed. Is she taking that?
It's very as needed. She used to be really aggressive and agitated.
Yeah.
But I think it's rare that they give her that. She pretty much just takes the one blood pressure medication daily.
Okay.
And that's, everything else we just kind of kept.
I see the other kind of bowel regimen, magnesium, Marilac, Senna. And then is she taking the Zoloft 100 milligrams every day?
I don't think she is, no.
Okay.
Yeah. I think we stopped that a long time ago.
Okay. And then I also see trazodone on this list. Is she taking that at night?
I think so, yeah.
And it says here it's as needed.
Yeah.
Does she get it every night? No, just sometimes.
Yeah.
And it's the 50 milligram dose?
Yes.
Okay. Let me just make a few notes.
Yeah, she had a long morning. She's been out and about for the first time in a long time. Action-packed day. Went to the shopping center. She's been having a good time.
She's off snoring. Oh yeah.
Anybody in the family have any history of memory or thinking changes? Okay. And any history in the family of neurologic diagnoses? Any changes? Okay. What's the highest level of schooling that she's finished?
GED.
I'm just gonna walk in between the two of you for just a moment. Hi there, Carlos.
Mom.
Carlos, hi there. Carlos, hi there. Hi. Well, I don't want to disturb you too much, but let me just see if I can move your arm around. Is that okay?
Yeah,
Sorry
see
about
some-
my cold hands.
See the stiffness.
Yeah, this is
Yeah.
okay. Let's see. Okay. Thank you, Carlos. And then let me try the other hand. Can I try this hand? I'm so
That's
sorry.
the-
I'm just moving your arm.
That's the one that's really.
Yeah. Okay. And I'm gonna move your legs now. Sorry about that. She gives you a weird look. She's saying, "What is she doing?"
I don't know. It's people.
All right.
I know.
Carlos, can you show me a thumbs up? Show me a thumbs
What's
up.
going on right
Show
now?
me, yeah, okay. Is this, Carlos, is this a pen? Is this a pen?
I don't know. Tell her.
Okay, so you.
Okay. I'm just making a few quick notes.
You like, what just happened?
Yeah, I know. Like, what is that?
Back to sleep.
Yeah. That was really funny though.
Yeah, she's still here.
I'm still here.
Yeah.
We're all still here. Okay.
You are funny.
Yeah, that was.
It just got good, huh? Right when the sleep got
Yeah,
good.
I know.
Yeah, was that a good dream?
I know.
Okay. Can you mimic me? Carlos, can you do this? Can you tap like this? No? Okay.
You like my pants?
Carlos, can you follow my finger? Can you look at this? Can you look at this? How about over here? Can you look? Over here? Look at this. How about my face? Carlos, take a look. Carlos, can you look at my face? No? Okay. Okay. So, let's regroup and just talk about a few things all together. So, when she last saw Dr. Shaw, they said that she was at the level of what we would call a moderate dementia due to early onset Alzheimer's disease. At this point, she's at the level of a severe dementia due to Alzheimer's disease. I don't think that'll surprise you too much. And so, you know, I took a look at her MRI scan. The last one we have is from 2019. In theory, we could repeat a scan.
Yeah.
Would you like that?
That was his question.
Yeah.
Yeah,
Okay.
yeah,
Yeah.
definitely.
It won't change our management, but
Yeah.
it's just if you want the information
I would
about
love
what
to
her
do
brain.
that.
Yeah.
Mm-hmm.
Okay. I'll go ahead.
Okay.
I've been hearing people refer to like the different types of how people, I guess, grade the Alzheimer's, like 7A, 7B. Do you have like?
So we don't tend to do that, you
Okay.
know, in the clinic setting. There is this thing called the FAST scale, FAST, that you can look up, and I think patients and families sort of like it because you can get more quantitative with it. But those features are not. They don't always map on to what we see or the progression that we see or how quickly we see the progression.
Mhm.
So we tend to have larger categories like mild, moderate, or severe dementia. So, she fits into the severe dementia category. So as far as other testing goes, she had blood work back in 2019 where they looked at a vitamin B12 level and the thyroid level. If we wanted to, we could check those things again, if they're within her goals of care. The reason to do it is, if those levels are abnormal, there are treatments for them. Those are things that can affect memory and thinking.
Yeah, okay.
But some patients and families decide, we don't want to put her through a blood stick, and in which case that's fine too. What do you think?
She just had blood tests done, but I don't think that was included.
Okay.
I don't know. What do you think, Justy?
mean, depending on, the procedures.
It's just a blood draw.
A blood draw.
I don't see why not.
Yeah.
Okay.
Yeah.
And, if you're talking at home and you decide, actually today you can get it just done on the second floor if you want. So you don't have to come back. But just, if you're outside the room and you start talking and you decide, we don't want to put her through that, then you don't have to do it, okay? The EEG is a test she's had before, and at that time, fortunately, it didn't show any evidence of seizures. This was 2021. So the way we diagnose seizures is we do this EEG. So you may remember they kind of put stickers on her scalp, and then they look at the brain waves. Anybody with Alzheimer's disease is at increased risk for seizures. If it's something that we identify, then it's treatable, and it's possible if she has them that they're causing kind of cognitive symptoms that are undertreated, or the sleepiness could partly be due to that. If we do it, I'm hoping the EEG is normal and everything's fine. But the question is whether that would be within her goals of care to go through that.
I don't think so.
Yeah. Okay.
No.
And what about the barium swallow evaluation? So in addition to the bedside swallow evaluation she's already had, and you could do a more formal swallow evaluation where she comes in and they use this contrast to see where the food is going, and then afterwards you meet with a speech and swallowing therapist who can give recommendations about what her diet should be like. It sounds like you've already met with somebody, but if you're looking for the formal evaluation, I'm happy to facilitate that. If you're happy with where things are and the pureed diet, then we don't need to go through all that.
Yeah, I think she's okay.
Okay.
Yeah.
Okay, so I saw in the palliative care notes there was a mention of a referral for consideration of Botox for the stiffness. Has she already been referred to the spasticity clinic? She has not.
No, we were trying to figure out what and who and where.
I'm happy to make a referral if that's something that, again, would be within our goals of care.
Definitely.
Okay.
Yeah. You good?
So I'm referring to what's called the spasticity clinic. Spasticity is just kind of how rigid her limbs are, and then they will evaluate and determine whether Botox would be appropriate.
Is that only in Palo Alto, or do they have that in Emeryville or Pleasanton?
You'll have to ask when they call. To schedule.
Okay.
Yeah. And then the other thing I'll just mention is the Ativan is a medication that can cause confusion, it can cause sleepiness, it can sometimes have the reverse of the intended effect. So instead of calming somebody down, it can rev somebody up. And so we don't recommend Ativan. We try and avoid it when possible. I'd much rather she, for example, if the agitation is a problem, go back on the sertraline.
Okay.
Rather than getting the Ativan.
Okay.
That makes sense.
Yeah.
So
we can discontinue that for sure.
Yeah. It sounds like she's doing well behaviorally.
Yeah.
So okay. That was everything that I wanted to talk about. What questions do you have for me, honey?
The main question I was talking to Dr. Hannah about was I know like there's a gray area as far as prognosis and timelines go, but he told me to ask like in your professional opinion and your experience with the severe Alzheimer's diagnosis and her evaluation today, if you what would the prognosis possibly hypothetically what could that look like based on what you've seen?
Yeah. So I can't say, in December this is going to happen, next June this will happen.
Right.
I can say that this kind of stiffness and decreased mobility is something that we see in late stages of Alzheimer's disease. And so, unfortunately, I anticipate that the stiffness and decreased mobility will continue to get worse over time. And so what we often see is people get more and more chair-bound or bed-bound or wheelchair-bound. And the difficulty with swallowing is also something that we see.
That's why I asked. Yeah, that's why.
And so that is something we often see. And the concern, of course, is that, you're going to swallow down the wrong, down the air pipe. And so then people can get pneumonias from that, or they can choke. And so that's really something that we get worried about when people have difficulties like that. From the time of diagnosis, people on average will live sort of 3 to 8 years.
Yep, I know that.
But it really varies and runs the gamut.
Just depends, yeah.
And it just depends. So that I can't tell you for sure what will happen. But it sounds like you're aware. I don't know how long this chapter is going to be, but you can still think of it as sort of her last chapter. We just don't know how long it is.
Okay.
It sounds like you're focused on the right things, which is just thinking about what would she want, what would she not want, what's within her goals of care, what's not, how can we make her comfortable, how can we make sure she's not in a lot of pain, and kind of focus on those kinds of things.
Yeah. Sound good?
Does that sound good? Okay. So it was wonderful to meet you all. Thank you all so much for coming in to the clinic. You can't see me, but thank you so much. It was nice to meet you. So it's up to you. If you want to see me in 9 months' time or something like that, you're very welcome to come back in and we can check in and see how things are going. But if you want to streamline your doctor's visits, then just follow up with Spasticity Clinic and they'll help with the movements.
Yeah, I'd rather just have something on the books just in case, because it takes a while.
Yeah, you can schedule that at the checkout desk.
Okay.
Okay?
Cool.
All right, thanks very much.
Thank you.
Thanks.
Thank you.
This is a reflection of my day today. I don't even know if I want to talk about it. Oh. Y'all, it was a long day. Fuck. Okay, so let's talk about it. Got up at 7. Took my son to work at 8. Got up for an appointment about 8:30. Got to the home to pick my mama up at 9. It was an hour and a half drive this morning from Walnut Creek to Palo Alto all the way to Stanford. We've done this drive before, but things have changed. Today was a reflection that everything has changed so much. Because it's been a while since I took my mom out there, right? So the drive there was fine. She was a little tired. She was basically knocked out when I got there. And then, the drive there was fine. She was just sleepy, relaxing. She hadn't been out in a while. I could tell she was enjoying just being out and taking everything in. And then we stopped and went to the Stanford Shopping Center, got her something to eat, and then we took her to check in. Everything went smooth, filled out her paperwork and everything. We get into the doctor. The doctor tells us, she tells me basically everything that I already knew. And when I say that, I mean that she confirmed everything that I was thinking about my mom's status, what level or stage of Alzheimer's she has, which is what they're calling severe late stage Alzheimer's. And although I already knew that, and although I see her and I see the changes, today was the first day that I saw her as like an outsider, how outsiders see her, the drastic change. And she just, she's smiling, she's herself, she's there, she recognized us. That stuff is there, but you can see the progression of this disease. You guys can see that because you don't know her, but today I saw that, like, from the outside looking in. She was so helpless. you know. So that was that. That was that. So on the way home, Marlon drove. So all of a sudden, she needed to use the bathroom. And then shortly thereafter, she just started throwing up. Like on the way home, she just started throwing up, and it was like, what the heck? But luckily I always have a go bag, what I call a go bag. I'll make a video about that one of these days, of like things you need to have to be prepared for anything. I was so glad that was in the back seat. So we got off the freeway, pulled over into a parking lot, and had an extra set of clothes, so I was able to clean her up. I had some wipes, I was able to wipe everything up. Got her all situated, sat her back, in the car, got her comfortable again, and then put some chucks across her chest just in case, and kind of made a little situation for her. Then we hit the road again, and she started again. So what I ended up doing was I took 2 pull-ups, and I kind of I had one this way, and then I put another one inside the opposite way, so like the leg holes were covered up. And then I folded the top of the diaper down, and I made it like a diaper bucket. That's what I started calling it, a diaper bucket. And so that way, as we're riding down the freeway, I can come from the back seat and sort of hold her diaper bucket. And y'all, she threw up 5 times from Fremont all the way to Pleasant Hill. It was quite the situation. And she was just tired. I felt really selfish for having, for me having to put her through a long ride to and from like that, because I wanted answers, and I wanted, to know, and maybe I could have just left her where she was and just let everything do what it's doing, The good thing about it is we are going to go to get an MRI of her brain to compare it to the last one that she had. That was in 2019, just to see what everything looks like. I find those things interesting. Before she was diagnosed, when I did see the scans and the images of her brain, and I compared it to Google, it was clear that it was Alzheimer's disease, and that's a different story. How did they not see that? That's my question. Why did it take 2 more years for somebody to even mention that? Anyway, yeah, so we're getting another scan at some point just to see what everything is looking like. And I'm almost like, do I even waste my time? But, the purpose of all of this is to share, to educate. So I'm going to land on that. And maybe there's a reason why we need the scan. I don't know. But yeah, that was my day. This hair is a result of craziness and having to ride down the highways with all windows down. But because I'm speechless. I am speechless. I'm tired. It's been a long day. So until next time, thank you all for being here. Thank you all for being on this journey with me. There is a lot more in the works, a lot more positivity in store, and y'all would be proud of me. My mama would be proud of me for the things that are coming up. So thank you, and I'll see y'all next time.